Okay, I have some competition from the presentation behind me, so I'm going to have to speak quite loudly. As Salvatore says, my name is Celia Papas, and I am a EURES advisor from the United Kingdom. Can you guess which part of the United Kingdom? Which country? Scotland. I thought you would recognise the accent. Okay, just to make clear, this is going to be talking about healthcare recruitment in the United Kingdom. So it's not living and working. I'm only going to talk about the healthcare recruitment. Is that okay? One of the main some of the main considerations that you have to think about when you're looking for jobs in the United Kingdom in the healthcare sector is, where are the shortages? What are we looking for? What do we need? You also have to think about being registered with the bodies. For example, if you're a nurse, it's the NMC, which is the Nursing and Midwifery Council. If you're a doctor, it's the General Medical Council. So you have to be registered before you can actually work in any of these professions. The other big concern is, well, where do you look for work? You're here in Italy, you're not familiar with the situation in the United Kingdom, so you need to know where you can start your job search. And we will be talking about the National Health Service, which we in the UK refer to as the NHS, which is the shortened version because we're a bit lazy at saying always the National Health Service. And the National Health Service is one of the largest publicly funded healthcare systems in the world. And it is one of the biggest employers in Europe, employing over 1.5 million people. And at the end of the presentation, I'm going to talk about the project that EURES UK is involved in with the National Health Service. So it's a recruitment project that I'd like to give you some specific information on. Can everyone hear me? Can everyone understand? Perfecto. So, if we look at the shortages that we have in the United Kingdom at the moment, there are a number. So we're, as well as looking for nurses, we also have a severe shortage of consultants. Now, consultants are doctors who are at the top of their field. So they're very high up, but we are almost at crisis point in the United Kingdom. So great is our need. The nurses that we're looking for are quite specific. It's quite specific the kind of nurses we're looking for and where the speciality should lie. And this is giving you some kind of idea. Nurses who can work in an operating theatre, and nurses who are experienced with neonatal, newborn children, paediatrics, oncology. There are different specifications. And also there's medical and dental technologists, nuclear medicine and radiotherapy. So this is just a kind of overview of what we're looking for at this moment in time. There are other opportunities, but this is where we have the real need. Now, because you've been trained in Italy, you live in Italy, you are Italian, I think most of you, you have to think, how can you describe your job in English? Because when you're looking at the job adverts, you have to know what the employer is looking for. So, it's very important to know what your job title is in English, not only Italian. And you should also know the description and the job duties that you have so that you can relate it to the job advert that you're applying for. Now these can differ from country to country. Now there is an organisation called NARIC, which is they compare the qualifications from one country to the UK. However, there is a charge for this. You have to pay for this service. So my advice is, if it's not necessary, then don't do it. Wait until the employer says, okay, I'm interested, however, I need more information, I need you to compare your qualifications. We have been recruiting for quite some time from Europe. So the qualifications for doctors, dentists, nurses, psychologists, etc., they are recognised as an automatic recognition from the United Kingdom. So there may be no need for you to do the comparison. If you want to know what studies go with your job profiles, you can access the information on the government website, which is gov.uk, gov.uk. Very simple, but a lot of good information. You can also find information under the National Career Service, and you can find things like what salary you can expect, how you can continuously improve, how you can train, can specialise, etc. while you're working in the UK. When you go to register, the body that you go to register with, whether it's the General Medical Council or the Nursing and Midwifery Council, they will know if your qualification is equivalent to the UK qualification. So it's something not to get too concerned about at this point. We've mentioned the regulatory bodies, and we have the General Medical Council, which I said is for doctors, the General Pharmaceutical Council, which is for pharmacists. Then you have your health and care professionals, your General Dental Council, and your Nursing and Midwifery Council. Now, to register, there is a cost, and it's not a one-off cost. You have to pay this registration fee every year. It's not only for UK, it's not only for European nationals. If you're in the UK, trained in the UK, you also have to pay this. And there's things like police checks. If you were coming from Italy to work in the UK as a nurse, you would need to have the police check done from Italy to present to the UK employer. And then when you come to the UK to start work, they would do a police check from the UK. Now, if you have never been in the UK, you're not going to have a record. So everything should be okay. But this is something, again, they do every single year. And it's to make sure that you have good character and you have no criminal record, because you're working with vulnerable people, and we have to make sure that they are safe. Now, there are different prices depending on what job you're going to be doing. So for the health and care professionals, it's £160, and that's a 2-year registration. If you're a dentist, for the full year, it is £576. So it is quite a lot of money. However, the salary reflects that. You're going to be getting a good salary, so it's not going to be too much of a problem to pay this money every year. Language skills. This is where we seem to be finding the biggest problem in Europe. Because if you think that you're dealing with people who are sick and who are needing your care and attention, it's very likely that they don't speak a second language. So they speak English. So your English has to be of a really good level. And what we've been finding, the biggest problem from Europe is that, yes, we can find the skills, Yes, we can find the experience, but the language is where we have the biggest problem. So it's really worth investing in some language lessons, if you can, before you come to the United Kingdom. As a European Economic Area national, you have to have sufficient level. If you were coming from outside of Europe, there is an actual test that you must pass. But it is understood, even although you don't have a test to pass, that you still have to have a certain level of English. If you are coming as a nurse, we would expect you to have the European standard of B2. That would be the minimum requirement for nursing professionals. If you were coming to work as a doctor, then we would expect C1. That would be the minimum requirement for a doctor. And it's understandable because you have people's lives in your hands. There's a lot is at stake. So you have to be able to communicate with the patient, and also you're going to require not just to be able to speak, but you're going to require some writing skills as well. What we have here is the National Health Service jobs. This is where you find the jobs in the National Health Service for England and Wales. If I can explain something to you, the United Kingdom is made up of 4 countries. So you have England, Northern Ireland, Wales and Scotland. England and Wales are under the kind of one body, but there are what we call devolved powers for both Scotland and for Wales, because we have our own government, we have a devolved government there. So there will be some differences, but normally the standards are the same across all the countries. The level of salary will be the same across all the countries, but it's just that there are some small differences. So for example, if you want to look for jobs, you can click on Browse Jobs. You can enter a keyword, and let's enter nurse, for example. Press search, and this tells you there are 4,434 available nursing jobs. So it gives you some idea of the scale of what is out there. There are great possibilities. I can't not mention Scotland, it's my country, but you'll see that it's a different website because we like to be different. We like to have our independence, well, some independence, and you can see if we click on the latest vacancies in the NHS Scotland, it's going to take you through to what's available there. And then you have your different categories. If we look at nursing and midwifery, there are 292 vacancies, so it's a smaller number, but if you look at the population of the UK being about 61 million and the population of Scotland being just over 5 million, you can see where you're going to get smaller numbers. But this tells you the jobs that are available. It tells you if you want to have further details, then you would click into each job. It would tell you how to apply, and a lot of these jobs you would apply online. That can be quite tricky. It's not the easiest to navigate some of these jobs, but it's worth persevering and practicing. If you're looking to find out information about your career path, how you can specialise, what the conditions are for working with the National Health Service, then you would go on to the NHS Careers website in the UK. And I'll click onto this just to give you a snapshot. This tells you information about working in the National Health Service. You can explore all the different careers, and then you can also click on to search the jobs, which takes you back to the page we were in originally. So it's quite easy to navigate as long as you have the necessary language you understand. So, I've spoken a lot about the National Health Service because we're actually working with the National Health Service at the moment. They are actively working with EURES UK and other European countries to try and recruit from Europe to fill the skill shortages. If we can recruit from Europe, it means that we don't need work permits or visas, and it's an easier route. So this is the choice that the NHS has made. However, there are agencies, there are company websites, there are professional magazines. There is not just one way. There is not just one way to find a job. There are many different ways. But what I will say at the moment, with the project that we're involved with the National Health Service, they are offering full-time and permanent jobs. Some of the agencies will offer a 0 hours contract, so there's a little bit of uncertainty involved there. But we are offering full-time, which is between 37 and 40 hours per week, and it's a permanent job if you want it. If you want to stay forever, you can. If you want to come back to Italy after a couple of years, again, perfectly acceptable. So, things to keep in mind: you need to be registered with whatever body is involved with you. So if you're a nurse, with the Nurses and Midwifery Council. If you are not registered, you cannot work. You can apply for the job and be accepted for the job and then register, but you must be registered in order to start work. You have your own website with the National Health Service for recruitment. And the good thing about the UK is that you would not be expected to go in and know exactly what to do in a British hospital. You would have a period of supervised work. So that means there would be someone there to be your mentor, to help you out, and to make sure that you understood the processes before you were left alone. And also, if you look on the National Health Service career website, it talks about what career development there is, and it gives you some kind of idea of how the National Health Service works. I've spoken about the project that we're doing, and the project we're doing at the moment is in the West Midlands. The West Midlands is like Birmingham, Worcester, Solihull. It's central England, and they're needing over 250 nurses in this area alone. Now, we don't expect to get 250 nurses from Italy, but we would like some. We would like to have some success. And these are the categories. These are the categories that we're looking for at the moment. So you can see that there are quite a number, but there's quite a lot based on paediatrics, so it's children, neonatal, and surgery. So we're looking for people who can work in a theatre, in the operating theatre. If you start work, you would be coming in at what we call Band 5. Band 5 is the grade that you would start at. The minimum salary for Band 5 is £21,478 per year, and that goes up to a maximum for Band 6 at about £34,500. How does that compare to Italy? Good, bad, same? Similar? Do you know?
Is it before the taxes?
Always before the tax. is what you call it brutto? Brutto. Lordo. You pay tax at 20%, but you don't pay tax. If you're earning £21,000, you have a £10,000 tax-free allowance. So you would pay tax on 11,478. So that is your first deduction, is your tax. Your second deduction, which is mandatory, is for what we call national insurance contributions, and that's the same as your social security in Italy. So that pays for your health care. It pays if you are unemployed or you're sick or you're pregnant, and also for the pension. And it's a difficult calculation, but it works out approximately 12%. That is it. You do not have to do a tax return at the end of the year. Those are the two things that will come from your salary. With this project, the West Midlands, they will pay for your first month's accommodation. So if you're successful at the interview, then they will pay for your flight from Italy to the UK. They will meet you at the UK airport and take you to your accommodation. And you will have free accommodation for 1 month. During that month, you will have what we call a mentor, which is someone to give you guidance and advice. They will help you find permanent accommodation. They will help you open a bank account, get your national insurance number, and all the different things that you have to do when you're starting up in the United Kingdom. You will have an induction program, so that's a 6-week program to introduce you to working in the hospital in the West Midlands. But you will have support for at least 6 months from your mentor. If after 6 months you find you need longer, then that can be arranged as well. That will not be a problem. What they need in order to be successful for this process is you need at least 12 months nursing experience and a minimum level of B2 in English. So those are the minimum: 12 months experience and level B2 in English. And because we're doing the project with this hospital, or the hospitals in this area, they have made the process even simpler. You don't need to apply online. You send your CV to this person here. I have some leaflets which you don't have to take this information down. You send your CV. If you are successful at the CV stage, then there will be an interview stage. If there are enough candidates in Italy, the employer will come to Italy to do the interview. If you pass the interview, on the same day you will be offered the job. You will be offered the job on that day, and you will be given a start date. There will also be assistance with the registration process, so they will help you through the registration with the Nurses and Midwifery Council. In case there are any doctors there, this just gives you some idea of the salary that you can expect as a doctor. And this is current, it's from April 2014. So depending on what grade you are, if you're a specialist, you can see that the salary is quite attractive. If you are a consultant, which is what we're looking for in Scotland at the moment, you can get a basic salary of between £75,000 and £101,000 per year. You never find a poor consultant. They're always very, very comfortable. They're also looking, do you know what a GP means? A general practitioner, which is like a family doctor. They're also looking for family doctors down in the West Midlands. And they can normally earn between £54,000 and £82,000. But again, we're having some shortages in that area as well. Again, information about pay, about jobs, you can look on the National Health Service website. This is just a little map, it's not a very good map, to show you where the West Midlands are. And it's a little bit clear, but you can see there's Shropshire, Staffordshire, Herefordshire, Worcestershire, Warwickshire, the West Midlands. All of these areas in the dark green area is where we're looking for the nurses. So you have good train links to London, to Wales, to the rest of England. Scotland is a little bit further away, it's about 4 hours on the train. I do the journey quite regularly. But there's lots to do, there's lots to satisfy everyone. Accommodation, it will depend where you are within that area, but it is nothing like the level of London accommodation. So it's going to be affordable, it's going to be in a decent area because you're going to have help from people who live there to guide you on where the best place is to live. Didn't mean to do that, sorry. Does anyone have any questions?
Yes, if a doctor finishes studying in Italy after 6 years of study, which is the first bank? 5 or 6?
A doctor?
Yeah, a doctor.
A doctor wouldn't be 5 or 6, that's for nurses. Normally the doctors, it's something called ST, you would have ST3, ST4, it goes like that. On that subject, there's something happening at the moment that we're looking for a level of ST3 doctors. They're called clinical fellows. So you have done your university and probably 2 years of actual practical experience in the hospital, but you're still training. And they're looking for that level of doctor in anaesthetics. But again, this project, it's kind of expanding as more and more hospitals are learning about this. More and more hospitals say, well, we need this, we need something else. So, but at the moment, this is the knowledge that we have, that they're looking for ST3 clinical fellows. If you go onto the National Health Service website, that should give a description of the level.
And I discovered that there is something very crazy because some recruiters, they tell you, you are band 5, and then the General Pharmaceutical Council tell you, no, you are 6, and then you are talking to your friend from the dentist council and say, no, you can be band 7, so you're confused, you can say nothing.
Okay, because you've mentioned all these different bodies, but if you are a doctor, then you're not looking at the Pharmaceutical Council, you're not looking at the nursing one, you would look at the General Medical Council. But if you look on the NHS careers, that should be able to give you a description of the different levels. Are you a doctor or?
No, I am a pharmacist, but...
A pharmacist. Your boyfriend is a doctor. If you want to come later to the UK desk, I can maybe perhaps give you some guidance there.
Thanks so much, because I was confused.
It is confusing, and I'm not medically trained, and I've had to learn a lot, so much, because when the hospitals are saying, well, we need this, we need, etc., I have to say, can you explain exactly what is that, so that I can explain to people.
Because when university is sending you in the UK, you can start as a band 6, talking about pharmacists.
Okay.
If you're going alone, you can start as a band 5, overpaid,
Yeah.
with a big mouse in your house, close to the Thames, with the fucking castle room.
If that's London, London is a bit different because London is so expensive to live. And this is why I think this is attractive, because it's not London. And I'll give you an example. We have an application from an Italian nurse who is actually in London. He's working in London in a hospital, and he's finding it expensive to live. So he found out about this project with the West Midlands, and he has applied because he's very interested. One of the questions that we got from Spain, with the registration with the Nurses and Midwifery Council, sometimes the process can take up to 3 months. So if the process we're talking about is you have your CV, then you have your interview and you're offered a job, what do you do between being offered the job and being registered? So the jobs on offer are band 5. That is the level. However, they will employ you at, I think, band 3 or band 4 until your registration comes through. So when you start and you're doing your induction program, the introduction to the UK nursing, you will be paid. You will not be paid at band 5 because you still haven't been registered, but you will be paid at a lower grade, and as soon as your registration comes through, whether you have finished training or not, you are paid at that level of band 5. So again, it takes away some of the financial worries that people may have, leaving your country, having to live for the first month without any salary. At least you know at the end of the first month there will be a salary there for you. Anything else?
I would like to ask, is it difficult to find a job in UK if you are a lab technician? I mean the one who makes blood analysis and so on.
If you are a lab technician,
Exactly, yeah.
again, I know I always say this, but I think the National Health Service website is a huge, huge website. I know you were speaking to my colleague, did you have a chance to look? No, I think there are a lot of opportunities out there. Key things are your qualifications, if you have the qualifications, and your level of English. Probably your level of English has to be a little bit different because you're doing more work, not with the patients, but within a laboratory. And a lot of the language from the laboratory will be similar to the language in Italian. It's a similar kind of language. So you may not need the exact same level of English as perhaps a nurse would need. But is it easy? I would say nothing is easy. I don't think there's any.
So we don't there is no shortage of
No, I don't. There's not any recognised shortage. At this moment, there is no recognised shortage. But remember, you are coming from a member state, you're Italian, you do not have to fit into the category of a shortage. The reason I'm showing you the shortages is to give you an idea where the majority of the jobs lie.